Right, let's talk to Dr. Layla McCay about this all, though. She's director at the NHS Confederation and joins us. Good morning to you.
Good morning.
Good morning. I mean, we've got the great news about the vaccine from Oxford and AstraZeneca, which I'd love to get on to. First up, though, let's talk about these different tiers. Number 10 are very, very keen to make clear, look, it's not a lockdown. We've got tiers 1, 2 and 3, although they're kind of tiers 2, 3 and 4 really in all but name, aren't they? And we still don't know which part of the country is going to be in which tiers. But as far as you're aware, the NHS Confederation, I mean, do you have a clue of which areas are going to be going into which tiers and what the decision-making process is going to be there in terms of R numbers and infection rates?
I don't think that at the moment we know much more than anyone else, but what we are assuming and hoping is that those decisions will be made based on where the virus is most prevalent, where the cases are not going down fast enough, where NHS organisations are having so many cases that it threatens their ability to deliver other types of care. I think that these are all incredibly important factors when those decisions are being made, and we would certainly want to see those being factored in.
I mean, we've not been told what the exact measurements are, and it's a sort of a whole combination, isn't it? The R number, local, capacity in hospitals, and the direction of travel, the speed at which numbers are going down or not. But I mean, a lot of these measures, it's fascinating. Of course, non-essential shops being allowed to reopen, hairdressers allowed to reopen, restaurants. I mean, other than in top tier 3, when it's very high, restaurants are only allowed to do click and collect or takeaway delivery. Otherwise, as long as you're serving a meal in a pub or a restaurant, you are allowed to reopen. We've seen all the evidence from Public Health England and NHS about where transmission is happening, and it's largely workplaces, it's in the home. There's tiny levels of transmission. I think it's I think it's 2% in terms of in shops, and in restaurants and bars, I think it was only at about 4%. There's very little evidence that these places are where there is a problem of transition, according to the NHS's own data.
Well, certainly we want to see tiers that take into account the very best science of how to prevent transmission, and we will hope that that is very much front and centre of any final decisions being made. And as we know, as we get into winter, windows are closed, heating's on, people are a bit closer together with poorer ventilation than otherwise, and that really seems to be where the big risk is at the moment. So it's thinking about how to reduce those sorts of location risk factors as much as possible.
Yeah, I mean, that's certainly an issue, and that's one of the reasons why we tend to get more colds and flu does the rounds in winter. It's just we are more able to be susceptible to it. We told you we're going to have a very grim winter ahead. I mean, of course we are going to have a grim winter ahead, because winter is grim every single year. We have an NHS crisis every winter. We've increased capacity, but we see deaths going up. I mean, people are going to go, deaths are going up from a respiratory disease, this particular respiratory disease being COVID. Deaths go up from respiratory disease pretty much from October right through to February every single year, don't they?
They do, which is why it's extremely concerning that this winter, for the first time, we have this brand new virus that we know, when it is in the population in a high prevalence, will cause extra deaths on top of that, which is what everyone is so concerned about right now.
Indeed. And just finally, a brief word on the Oxford AstraZeneca vaccine. I mean, just fantastic news, 100 million doses we have. That could be the cheapest and quickest to roll out.
Well, at the moment, everybody is sitting on tenterhooks waiting to see what the regulators say about the various vaccines that are available, really keen to make sure that they are as solid and safe as possible, and if that is proven to be the case, to get them out there. Our members are ready to get moving with that mass vaccination programme. It's going to be a huge mission, but it's certainly one that we're ready to take on.
And you'd take the vaccine?
Well, I'm in one of the lower risk groups, so I guess I'll have to wait until the people who are more vulnerable get it first.
OK, thank you so much, Dr. Layla McCay.